CEN Exam Cram video. Question 1. During a cardiac arrest, the first dose of epinephrine should be given immediately after the first defibrillation attempt, after 2 minutes of CPR, before any defibrillation attempts, only after obtaining an advanced airway. Question 2. A drowning victim is brought to the ED. The major physiological insult is hypothermia, pneumonia, hypoxia, dysrhythmia. Question 3. A patient presents after a house fire with dyspnea, sooty sputum, and a brassy cough. The priority nursing diagnosis is fluid volume deficit, impaired gas exchange, ineffective airway clearance, pain. Question 4. A patient with COPD and a history of carbon dioxide retention is receiving oxygen via nasal cannula at 4 liters per minute. The nurse notices the patient is becoming lethargic. The appropriate action is to increase the oxygen to 6 liters per minute, decrease the oxygen to 2 liters per minute, prepare for intubation. Administer naloxone. Question 5. A patient presents with chest pain, fever, and a friction rub on auscultation. The nurse suspects myocardial infarction, pericarditis, unstable angina, aortic stenosis. Question 6. A patient presents with altered mental status, fever, and a petechial rash. The nurse suspects viral meningitis, bacterial meningitis, encephalitis, anaphylaxis. Question 7. Which laboratory value is most specific for acute myocardial infarction? CEC-MV, myoglobin, troponin I, BNP. Question 8. A patient with third-degree complete heart block is bradycardic and hypotensive. The nurse should anticipate atropine 0.5 milligrams for push, transcutaneous pacing, adenosine 6 milligrams rapid for push, amiodarone 150 milligrams for. Question 9. A patient presents with an opioid overdose with respiratory depression. The nurse should administer flumazenol, naloxone, activated charcoal, atropine. Question 10. A patient presents with a high-pressure paint gun injury to the hand. The nurse's priority is soaking the hand in warm saline, icing and elevating the extremity, preparing the patient for surgical exploration, administering a digital block. Question 11. A patient in the ED is in ventricular tachycardia without a pulse. The nurse's priority intervention is administer amiodarone 300 milligrams for push. Perform immediate defibrillation with 120 to 200 J biphasic. Start chest compressions. Establish an advanced airway. Question 12. After a fall, a patient on warfarin is found to have a subdural hematoma on CT. The nurse anticipates administering clopidogrel, vitamin K, fresh frozen plasma, both B and C. Question 13. A 2-year-old child presents with a barking cough, stridor, and respiratory distress. The nurse suspects epiglottitis, croup, foreign body aspiration, asthma. Question 14. A patient develops a sudden, severe headache described as the worst headache of my life, along with nuchal rigidity and photophobia. The nurse suspects migraine headache, tension headache, subarachnoid hemorrhage, meningitis. Question 15. A patient with pelvic inflammatory disease is being discharged. Which statement indicates the patient understands the discharge instructions? Getting pregnant shouldn't be a problem once the infection goes away. I'll take the medicine for nausea when I feel sick to my stomach. I will be at increased risk for ectopic pregnancy. I will follow up with my doctor tomorrow. Question 16. A patient presents with altered mental status, meiosis, bradycardia, and copious secretions. The nurse suspects organophosphate poisoning. The treatment is naloxone, flumazenol, atropine, and pralidoxime, activated charcoal. Question 17. A patient is brought to the ED after being struck by lightning. Which finding is most concerning? Confusion, unequal pupils, tachypnea, hypertension. Question 18. A patient presents with hematemesis and melena. The nurse's priority is insert a nasogastric tube, administer oral vitamin K, establish 2 large-bore 4 lines, and administer fluids. Prepare the patient for an endoscopy. Question 19. A patient with a history of alcohol use disorder presents with confusion, ophthalmoplegia, and ataxia. The nurse suspects hepatic encephalopathy, Wernicke's encephalopathy, alcohol withdrawal, meningitis. Question 20. A 4-year-old presents with a 2-day history of a rash on the neck, chest, and back. The lesions on the neck are crusted, and the chest lesions are tiny vesicles on a pink base. The child has a temperature of 39.1 degrees Celsius. The father asks when the child can return to school. The nurse advises 24 hours after the last fever above 38.3 degrees Celsius. Tomorrow, once all the lesions are crusted. In 2 weeks when all the lesions are crusted.